I'm a king, I think I'm a king,
So welcome to the first ever Africa Web TV podcast. Today I'm with a colleague of mine, Dr. Deborah Maufi. She's a medical doctor, but she's also a presenter with Africa Web TV. I'm going to have a discussion with her about the information, disinformation, the perception, and all of that about COVID in Africa. You just came back from Tanzania specifically. We know in Tanzania there is no COVID, if we have to believe what the government is saying. But all jokes apart, tell us about the COVID situation in Africa and in Tanzania in general.
Well, yeah, thank you, Femi. It's quite interesting when we think about COVID in Africa, and in some countries it goes as far as to claim that there is no COVID in certain countries, because there is COVID in Africa, for sure. There are over 3.5 million cases, infections in Africa. However, I can understand why a lot of people are not putting too much effort towards it, because if you compare the death rate and the infection rate, it's very low. From over 3.5 million people, so far we've had less than 100,000 deaths. That's about a little bit over 90,000 deaths. So if you put it in percentage, it's about 2.5%. And that's not, it's not very alarming, I would say, given the fact that Africa has a long-standing history of far worse fatalities from diseases, far much worse morbidities and mortalities. So I don't really blame people for thinking that, they cannot be infected or they're not at risk of getting COVID just because they're in Africa, but it's simply based on what they've experienced in the past. But there is COVID in Africa, for sure. Even in Tanzania, where it's publicly claimed that there is no COVID in Tanzania, there is COVID. It's just that the number of cases, the rate of infection, the number of deaths are not high enough compared to certain other diseases that we've been battling for years.
You just came back a few weeks ago from a long stay in Tanzania. And
3 months.
3 months is long.
It's not long. I could have stayed longer, but...
Okay. I wish I could stay 3 months somewhere in Africa at the moment. In any case, what were the wildest things you've heard about COVID? We will come to vaccination later, but about COVID itself, what are the perception of the people themselves?
Interesting, because there are multiple theories around COVID, the COVID virus in Africa. In Tanzania specifically, I've had a lot of people talk about it being sort of a weapon brought to Africa to depopulate the region, because they feel that the Western world thinks very little of Africans and that we are the least productive race in the world, that they want to cut off some of us. I mean, globally, the population is too much that they want to reduce it, and where best to start? Africa. So that's one of the perceptions that's running around on the streets. Another bit is the religious aspect to it. Africa is a very religious continent. We have Christians, Muslims, and the indigenous community. We have so many religions all over. And particularly the Christianity and Islam occupies a big percentage of the religious community. So there are also speculations around that this is preparations for the Antichrist, that the coronavirus was brought about to bring control and make room for the New World Order, so that at some point everyone will have to accept the vaccine, which is metaphorically the mark of the Antichrist. So then if you don't have the vaccine, then you cannot do anything. You cannot go to the supermarket, you cannot travel, you're basically confined. So those are some of the theories I've had around. And there's also, there was one more interesting one, 5G technology, with advancements in technology and the Western world wanting to introduce 5G technology, that is also a factor, one of the risk factors for COVID, to get COVID. And so there's a lot of backlash towards that people don't want the 5G technology to come in because they feel it might contribute to further spread of the virus.
Why 5G? Because that is one aspect of all these theories that I'm not able to explain away. We have 4G.
Yeah.
Before then, there was 3G.
Yeah.
Before then, there was 2G. And before then, there was 1G.
Those G.
So we have all these Gs. Yeah. And until now, nobody was worried. It didn't cause any of those things. Why 5G? Because people are already working on 6G.
Yeah.
So why are we afraid of Gs now?
Yeah. Interesting question. I don't really have an answer to that. But one of the theories I've had on the street is that 5G technology is far much stronger, which or the rays or radiation or something that comes out of 5G technology.
And that causes corona.
It alters your genetic makeup or something like that, and then it predisposes you to getting COVID. Or I also can't really explain that bit because it just doesn't make sense to me, and I'm not even trying to make sense out of it. Because speaking from a medical perspective, it doesn't make sense.
Okay.
Yeah.
What are they saying about vaccination itself?
Yeah.
I know in Tanzania there is no COVID, so we're not talking about vaccination.
Tanzania has gone very public about the fact that they are not welcoming the vaccination in the country. They are going to go towards the herbal medicine direction, which it's a good thing. It's a very good thing. We just need to test them that they actually work for the specific purpose they intended to do. But yeah, so about such misconceptions, I remember reading an article a few weeks ago, a survey done by the Africa CDC. And they conducted a study in 15 African countries, and they were trying to assess the willingness to accept the vaccine once it actually gets to you. And funny enough that in these 15 countries, I think the sample size was about a little bit over 15,000 people. About 80% of this population actually say that they are willing to get the vaccine, as long as it's proved to be safe. So we still have about 21% lingering around who either they were resistant or they were just not sure. And from this 20%, remaining 20%, the ones who are very sure that they don't want the vaccine, they also have the persuasion power to convert some of the people who are not certain. Okay. So we don't know, the number could go higher or lower, but yeah. Anyways, so we see that the number of the percentage of willingness is very high. But that does not mean that we don't have a problem yet, because there was also perceptions and attitudes and behaviors that also influence these decisions. And some of them included that some people thought that they are not at risk of getting COVID simply because they're African and it's a Western virus. Others thought that the vaccine itself is actually COVID, the virus itself. So if they inject it in you, then you're going to get COVID and then you're going to die. So it's a strategy to depopulate the region. There were also people who thought that the vaccine is one way to gain control, as I mentioned earlier, in the religious way that, to gain control over the world and make room for the new world order. And then you cannot do anything without the vaccine, which is basically the mark of the Antichrist.
Yeah, but so 80% say they want to take the vaccine.
But this is a generalized number because, mind you, Africa has 54 countries. The survey was done in only 15 countries. Mm-hmm. Ethiopia was leading with 94% willingness, and Democratic Republic of Congo was about 54% willingness. So it's still more than 50%. But then this is only in 15 countries. So it's a generalized survey. You cannot say that this resonates in every other African country. That's not even 50% of the African countries. And there are countries who have publicly declared that they are not going to get the vaccine. Tanzania, Madagascar,
I can understand if people say, okay, this thing went so fast. Mm-hmm. But Africa, that I know, that I grew up in, we were virtually fed with shots of vaccine growing up. So why would they not take something like a passport that will give them freedom to resume their normal lives?
So my opinion, and also based on a few conversations I've had with other Africans, this has really a lot to do with the colonial legacy. I think Africans have reached a point where they're just tired of being told what to do by the white man. I hope that sounded correct, like when I said by the white man. But there's that. So it's reached a point where Africans just want to stand on their own feet and dictate their own rules.
Yeah, but so is the time of pandemic, worldwide pandemic, the time to now say, hey, African pride? Because now it sounds like it's African pride against African health.
It's probably the right time, actually. So in my opinion, I would say it's the right time. Why? Because the Western world is highly affected. So they're losing their power over Africa.
Okay.
So this is the best time to actually stand up. You know, that we actually recognize, because in the past years, I think Africa, we had a bit of an inferiority complex, which was instilled in us from the colonial period onwards, and with slavery, and not just Africa, Black people in general. So I think that inferiority complex that was instilled in us kept us from moving forward, especially because the Western world was powerful. And when I say it was powerful, it's really powerful from our own resources. You know, they became powerful because of the wealth from Africa, and they had the technology to actually get it out faster and turn it into money faster than we could. So by that time, we actually woke up and realized, oh, this is actually our success. This is actually our success, our resources. They had already moved much further. But then now with the pandemic hitting harder in the Western world, it's a sort of like disempowered the Western world, which has also made Africa realize that, hey, they are not gods. We can actually rise up against them, and we actually do have the power, the resources to do that. The only thing I would say that's going to delay us is that we don't have sufficient technology, etc. But we also have the power to disempower the Western world, because it's our resources that they use to empower themselves in the first place. So this is actually the right time for Africa to stand up and do their own thing. I mean, we do have, for example, herbal medicine. What are these pharmaceutical drugs that we buy? They're basically herbs that were taken to a factory, added some more chemicals here and there, presented to you as a tablet or as a syrup, etc. But what's the primary content of that? It's a herb, which in Africa it's everywhere. You know, before we could get these pharmaceutical drugs or vaccines from the Western world, people were living hundreds of years. They didn't die, right? Yeah. Now, this is not me dismissing vaccines, because there are hundreds of vaccines that have come to us and they've worked. From influenza, TB, hepatitis, you know, we get polio, smallpox, smallpox has been eradicated in the world completely. Polio is almost every country is declared polio free because of these vaccines. So don't get me wrong. I'm not saying that they don't work. They work very well, in fact. My only point is that Africa also has the power to actually build their own system. And with this pandemic, it should actually be an awakening call to us that we need to strengthen our health systems, modernize them, you know, and use our readily available resources, which are being depleted and being used to actually empower the Western world, to actually do it ourselves, because we can. There's a very big population of young people in Africa right now, very innovative, very creative, educated, you know. They're really willing to go so far for the growth of their countries. So it's our time now, in short. Oh, okay, that went too far. You are a young person. I don't think that went too far. I mean, I get what you're trying to say, but from the medical point of view, I mean, I guess what you said just now is also from a personal point of view. Yeah. But from a medical point of view, do you think it is responsible
to deny the existence of COVID or to put it down to religion. Do you think it is responsible for people to just say, no, we're not going to take it because it's developed too fast and, it's a way for the West to take over our brains?
No, honestly, medically speaking, I think it's very irresponsible. Why do I say that? Regardless of the fact that the number of deaths are very small, are very low compared to, the number of infections, I would say one death is already one too many. It doesn't matter. If one person dies, that's already just one death too many. So we should not dismiss the fact that COVID is actually there in Africa. It's killing people, it's infecting people. Even if you don't die, you get sick, which of course it affects how you perform socially and economically. So it has the impact is much more than just that. So we should not dismiss it. From a medical point of view, I would say it's okay to not cause panic in people, but then it's also very important, safety first. Safety first. That's the most important part. That I think every country should take prevention measures. Campaigns around hand washing, social distancing, etc. I think that's very important to keep the population safe. Otherwise, if we completely dismiss it, and we know in Africa, I hate to say this, but it is the truth. What the leader says goes. That's like the father of the nation. So a lot of people who trust what he says, only a very small percentage would actually want to think with the mind of their own and say, okay, no, I'm going to do this. And even sometimes when you do, you get restricted by, the power above you that, hey, why are you doing this? Why we told you there's no COVID. There have been cases like that. There have been people who went to meetings and they were told, take off your mask. Why are you wearing a mask? Well, there's no COVID here. So there are things like that they make me, I would safely say it's not responsible for people to completely dismiss the fact that there's COVID in Africa. We might not be highly affected as people anticipated in the beginning of the pandemic, but we are. In fact, the World Health Organization in January just announced that the African region rate of transmission surged by 19%. Which has now moved Africa to be the second rate of transmission by region globally, second to North America. So it's not that it's not there. It's there. People are dying. It's just that I think a lot of people also sort of overlook it because there are also other mortality causes. So then they just overlook it, but COVID is there.
A couple of days ago, South Africa received its first consignment of the COVID vaccine. I know Egypt is also vaccinating her people. Are there any other countries where vaccination has started off?
So actually Seychelles was the very first African country to get vaccinations. They ordered, and I think around the first or second week of January, they already had their order shipped, and they started vaccinating their population. And then, of course, Egypt, Morocco followed through, I think Mauritius, if I'm not wrong, and then South Africa. And there was a bit of backlash on South Africa as to why they delayed to get the vaccine, given that more than 50% of the cases in Africa come from South Africa. And with the new strain in South Africa, they should have been the first. But they've now ordered their batch, and I think they've started vaccinating their people. But those are not just the only efforts, because most of the countries I've listed, they made deals with other private manufacturers. But then also the African Union, I know they've ordered a bit over almost 700 million vaccines. And the WHO, through the COVAX facility, the COVAX scheme, they've also ordered 600 million vaccines. Now, this sounds like a high number, but then the population in Africa is almost 1.5 billion people. So with the two orders from Africa Union and WHO, that will cover about 1.2, 1.3 billion population. Mind you, the dosage is given in two steps. So it's only enough to cover about 50% of the population.
Or less even.
Maybe, yeah, a little bit less.
600 million.
Well, it's 1.2 because it's 600
and
I
600,
think,
yeah.
I think around 670 million from AU and 600 from WHO. But yeah, that will give you around 1.27, 1.3, and that's about one round. That's less than 50% of the total population. But that's the first batch, and even with that, there are barriers that come with it because they have ordered it, but then having a vaccine is one thing, but there's a whole chain until it actually gets to the end user. And with this chain comes costs and resources, and it's a whole bomb, I would say. Yeah.
Yeah, you're saying that, and I'm just thinking back to what you said earlier about, they are using this perception of some people is that they're using this to depopulate Africa or reconquer Africa. But on the other hand, the vaccines are available now, and a lot of governments in Africa have really been slow because I think you mentioned just 6 countries from the 55 countries now. So is that not a kind of self-fulfilling prophecy? Because if they don't get the vaccine, people are going to die in mass anyway, which is why some people who are agitating against the vaccine are saying no, because they want to kill us. But if they don't get it, we're going to all die anyway.
We're going to die anyway. Yes and no.
Okay.
Yes and no. I mean, some people will probably die because they get a disease. But also one thing I think you should know, Femi, is that getting the vaccine does not guarantee you that you will never get COVID again.
That's not a very reassuring thought.
It is a fact, and the vaccine was developed in a very short period of time. Safety trials were done, so it's proved to be safe for use, or at least the benefits outweigh the side effects. So then it's safe to use. But then it's too early to say that it 100% protects you from getting COVID, because we've just started issuing it out.
Yeah.
So you can't, you just can't. It needs time. That's a longer analysis. It needs more time to actually.
But do we have enough time to wait in Africa, or we will find this out after we're all dead in Africa?
I don't think so. I mean, it's, in all honesty, I think the efforts that are being done to get the virus to Africa is actually good so far, because even in the Western world, not every country has the vaccine yet. It's there, but not everyone is getting. We are in Netherlands now, but we are not even close to getting the vaccine.
For people listening or watching, we are in the Netherlands, and the Netherlands ranks lowest country in Europe in terms of vaccination. To be factually right as we are talking, Netherlands is just one place above Bulgaria. Bulgaria ranks the lowest, and the Netherlands is just above it. So maybe Netherlands is an African country. So in conclusion, do you think the world is going to come back to the old normal in 2021?
I'm going to ask you a question right back. Do you want to go back to the old normal? I would say no. I don't think so. I don't think it's going to get back to the old normal in 2021. And why should it? I mean, I think if anything, this pandemic has taught us that we need to rearrange our old way of living, from climate change to our health, both personal and community health. There are so many things that this pandemic has brought into light that we should not take for granted. And I think even when it ends, or even when we get it under control, we should not go back to the old normal.
Yeah, but people want to socialize. People want to watch sport. People want to be joyful. People want to be happy. People want to mingle.
Very true. I mean, a new
want
normal.
to travel.
Yeah, I mean, a new normal does not mean that you discard everything that we did in the past and just start completely fresh.
What would you using the knowledge we've gained in the past 1 year, what would you consign forever to the old normal that you don't want to
To carry
have back
forward.
when this pandemic is over?
I'd say, well, we do need to reduce carbon emissions, for example. I mean, global warming. You see what's happening now. Yeah, with global warming, the air is polluted. So I feel like if we have a much more cleaner environment, much better, cleaner behaviors, I think that will really contribute to a better world. I mean, the rest we can still. We can do the
But
socials.
Africa has a really very tiny part in this global warming or whatever.
There's a reason why it's called global warming. Just because the emissions are more in the Western world than in Africa doesn't mean it will not affect Africa, because it's global warming. The ozone layer will still
Yeah,
get
but
depleted
I-
and
yeah.
affect everyone. So it's like everyone should take responsibility, whether you're in Antarctica or Africa or whatever. No matter how low your contribution to global warming is, it doesn't mean that then you should increase it or whatever. Just
But
it's everyone.
the reason I'm saying that is when it is not a big percentage in Africa, people are not able to see it, hold it, and it's not tangible. So people don't, it's very abstract to them. But I'm actually asking about tangible things we can see in Africa as Africans. What should we not go back to when we go to the new, better normal?
Oh wow, that's quickly from the top of my head, I would say we should practice more hygiene. That's the first thing I would say. We should practice more hygiene, because that's not just prevention against COVID, but many other diseases. What else? Yeah, I think that's it.
I think that is a good way to end anyway. Practice more hygiene so that we make sure things are cleaner than they used to be before the pandemic. More awareness,
Yeah,
and prevention.
But I think we should also revisit our healthcare system. I know there's been a lot of noise around healthcare system strengthening in Africa. We do have a lot of issues with access to health and quality healthcare, etc. But I think this is a time for us to actually reassess our healthcare system, modernize it, and actually make it work for us, by us. So I think it's a good chance for us to fill in the gaps. So yeah.
Well, that concludes our first podcast. Today, I've been talking with Dr. Deborah Maufi, who is also a presenter with Africa Web TV. I will recommend a song, a video that you can watch, but it's a song. It's called Shusha. The video is Babalevo featuring Diamond Platinum.
Tanzania.
And it's from Tanzania. So it's very appropriate just to keep you a bit cheerful. Have a nice time until we see you or you hear us again. Bye for now.
Thank you for listening. Goodbye.
I'm a king, yes, I'm a king, I think I'm a king,